Good afternoon. This is a presentation of a signature assignment for Community Health Nursing in 493 by Donna Hazelwood uh, through Aspen University. The signature assignment outline will include information on the summary, evaluation, and conclusion of the presentation that was our assignment for this class. There are pictures that were presented during the presentation through a PowerPoint presentation on what you need to know about heart health and an infographic that included information on healthy diet choices and the modifiable risk factors involved with heart disease, as well as information on a DASH diet, which is diet approaches to stop hypertension, and the numbers that are considered normal and what's considered high with blood pressure. With heart health, and with any type of health, a community health nurse has the responsibility of identifying health concerns and educating the public on the importance of making healthy lifestyle decisions. To improve the health of a community requires advocacy on the part of the community health nurse to promote health and prevent illness and injury, as well as to provide an access to care. In summary, my target audience was the community of Camp Verde and the surrounding area, and I chose the topic of heart health and what you need to know based on a community assessment that identified a health concern of cardiac disease as the #1 cause of death in the age group of 44 years old to 85 plus. These were found with statistics from Yavapai County, Arizona, which was through the Centers for Disease Control and Prevention of 2018. My presentation was held at the Camp Verde Community Library on April 13 of this year from 2 to 3 p.m. That was set up and scheduled by the library director and advertised through a press release and digital advertising of the event through the library. The press release was sent out to the library contacts. Also, an infographic was prepared as a handout with the majority of the information obtained through research from the American Heart Association, as well as other miscellaneous websites. On the day of the presentation, unfortunately, no one showed up. In evaluating my presentation, I found that the efforts to improve health concerns from the community were effective in my presentation because it had an impact on my role as a nurse, as well as modifying my own lifestyle through the information that I learned. The tools used in my evaluation were the resources that I found online, and I compiled information in an easy to understand format that included how to take a blood pressure, how to monitor blood sugar, the importance of nutrition with the DASH diet, again, diet approaches to stop hypertension. Blood pressure medication information was also provided, as well as some labs that were available that would give information on cholesterol levels and determining diabetes through a hemoglobin A1C. This presentation was given to my husband and received well. Also, my role as a nurse has evolved with education to patients being much more informative, that's presented in terms they can understand that can enhance their compliance of maintaining a healthy lifestyle. My presentation was satisfying and informative. Of course, there was dissatisfaction that no one showed up. However, the information has been put into practice by sharing it with my patients and making some changes myself. One change to consider would be to change the venue of my presentation to, say, an assisted living facility or the hospital to increase the chance of audience participation. In conclusion, in my role as a nurse, there's definitely a higher level of thinking, as well as more emphasis on education information that is provided to my patients, especially when it concerns cardiac disease and making healthy lifestyle choices. The best approach to discuss education with a patient is to ask the right questions, and to provide easy to understand information. Also encourage questions and make sure the patient understands the information that's been given to them. It's vital for a nurse to be acutely aware of how a patient presents, as well as their entire situation, that fosters trust and the development of a healthy nurse-to-patient relationship. When considering patient care, a good rule to follow is the risk versus benefit scenario. It serves to strengthen your role as a nurse in moving ahead with patient care. In reflection and the impact of this assignment, when I'm reflecting back on this assignment and the status of the community's health, not only locally, but all over the United States, it's definitely concerning due to cardiac disease being so prevalent. It's also concerning because a majority of the risk factors are modifiable and can result in a healthier population with more compliance, as well as being informed on the importance of managing one's heart health. Information is empowering and can result in change. The target population that I deal with, but since no one showed up to my presentation, are the patients that are in my care when in my role as a nurse. It's my responsibility as a nurse to provide pertinent information and educate patients on the necessity of making healthy lifestyle choices, especially with heart health. The resources that I utilized in this presentation are from the American Heart Association, the Centers for Disease Control and Prevention, our textbook, Population and Community Health Nursing, the Cleveland Clinic on Heart Healthy Diet Information, and Discover Health, which gave 6 facts about cholesterol, as well as the images that I used throughout the presentation that served to enhance the role of my PowerPoint. Thank you for the opportunity to have taken this class, and I learned a great deal about providing information to my patients and identifying health concerns in a community.